So my name is Kevin McDaid. I'm an orthopedic hand surgeon with Seaview Orthopaedics. Okay, so carpal tunnel syndrome is treated primarily non-operatively. It's a very common diagnosis. The initial treatment that I like to do is treat people with splints that they wear at nighttime, because carpal tunnel is primarily something that comes on at nighttime. If you don't do any better with the splinting, then we move to more invasive treatments such as corticosteroid injections, which is an office-based injection. And if that doesn't work, there is ultimately surgery, which is the final cure for carpal tunnel. So carpal tunnel syndrome is a nerve disorder. So it is a pinched nerve in your wrist. It can give you numbness and tingling going up into the fingertips, pain going across your wrist. Sometimes when it gets real bad, it goes all the way up into your shoulder. So treatment of, or diagnosis of carpal tunnel is primarily just from getting a history and physical of someone, finding out what their complaints are and what bothers them. Most of the time you can diagnose carpal tunnel just from questioning and examining in the office. Occasionally you need to get a nerve study to get if it's unclear and you want to find out if there's any other things that could be causing the numbness and tingling. So just to demonstrate, I'd see someone in an office. So the carpal tunnel is right here in your palm. So there's a big thick ligament that goes across the wrist here, and it will pinch the nerve underneath the ligament. So a good way to test for someone with carpal tunnel is simply by tapping on the nerve. So tapping down here, and if the patient experiences any tingling or burning or shooting pains going up into these three fingers, then that's a good sign that it's carpal tunnel. Another test is just holding on the nerve. This simulates the pressure rising inside the carpal tunnel. And again, if you get any of those same symptoms of numbness, tingling, pain, then that's a pretty good indication that you have carpal tunnel. Anybody can get carpal tunnel syndrome, so it's mostly activity related, so any line of work can get it. You always hear about people with that work on a computer all day that causing carpal tunnel, but it really can be anyone. The most likely people to get it are people that do hard, heavy manual labor, repetitive gripping, lifting. Certain medical conditions make you more prone to it, diabetes, pregnancy, hypothyroidism, but more or less it's your genetics that make you more prone to getting it, so there's not much you can do to prevent it in certain people. So the main thing to do to prevent carpal tunnel is overuse, so avoid repetitive activities. So anytime you can rest, change your overall positioning, and that's the best way to prevent carpal tunnel. But ultimately, there is no true prevention of carpal tunnel.